Core nucleus phaco chop. To begin with, phaco chop is quite challenge. You may hesitate to insert the chopper beneath the iris to the equator of nucleus. It is also difficult to hold the nucleus with varying density to perform the vertical phaco chop. However, it is not necessary to chop the entire nucleus. Similar to femto-laser-assisted cataract surgery, where the femto-laser cuts only the core nucleus and not beyond the iris margin, we can manually perform a core nucleus phaco chop with a phaco handpiece and chopper. After completing CCC and hydrodissection, aspirate the epinucleus in the central area. Embed the phaco tip into the core nucleus and hold the vacuum. Impale the epinucleus with a chopper, then slide it outward beneath the epinucleus. After hooking the chopper with the core nucleus, pull it back towards the phaco tip. The setting of vacuum is fixed 550 mm of mercury, aspiration flow is fixed 32 cubic centimeters per minute, phaco power is linear from 0% to 45%. The key to this maneuver is the depth at which the phaco tip is embedded in the core nucleus. The vacuum is merely supplementary. As long as the chopper hooks the core nucleus, the phaco tip can provide the counterforce needed to split it. This maneuver requires less phaco energy, reducing the risk of thermal injury and endothelial cell loss. Besides, core nucleus phaco chop does not rely on the red reflex, making it especially advantageous in cases where the red reflex is compromised. Additionally, one of the primary benefits of this maneuver is its ability to prevent further zonular dehiscence, a complication that can arise from excessive stress on the zonules. This maneuver minimizes the mechanical forces exerted on the zonules, thereby preserving their integrity. In cases involving a soft nucleus, core nucleus phaco chop offers significant advantages. Dividing the sculpted nucleus can be difficult since it is not solid enough to separate easily. However, with core nucleus phaco chop, vacuum assistance is not needed at all. The phaco tip alone can provide enough counterforce to split the soft nucleus, making the maneuver more efficient and gentle. When embedding the phaco tip into the core nucleus, be careful to minimize the phaco power to avoid penetrating through the nucleus. In cases of brown cataracts, where the nucleus is very dense and more challenging to emulsify, core nucleus phaco chop is particularly beneficial. This maneuver allows for efficient fragmentation of the dense nucleus with reduced phaco energy, decreasing the risk of zonular dehiscence by minimizing the mechanical forces exerted on the zonules. By effectively splitting the dense core nucleus into small fragments without relying on extensive vacuum or high phaco power settings, core nucleus phaco chop ensures a safer and more controlled procedure, leading to a beautiful recovery on the first day after surgery. In cases of white cataracts, the core nucleus is surrounded by a cloudy layer. However, the core nucleus can still be held with the phaco tip, and the edge of the core nucleus can be felt with the chopper. Fragmentation can be done safely with this maneuver. In femto-laser-assisted cataract surgery, this maneuver also works well. Once the phaco tip is embedded in the core nucleus, then impaled the chopper in the groove made by femto-laser. It is very easy to separate the fragments with the chopper. In cases of small pupil cataracts, sculpting a long enough groove for divide and conquer is impossible, without the use of an iris retractor or iris expander. However, once familiar with core nucleus phaco chop, fragmentation and emulsification are not a challenge at all. Slide the chopper outward under the edge of the iris, then hook the core nucleus. Fragmentation can then be completed. Since we disassembled only the core nucleus, epinucleus was left. The epinucleus can serve as a protective cushion during phacoemulsification and can be easily aspirated even without using phaco power. Overall, core nucleus phaco chop offers a more efficient and safer option for both routine and complex cases.